This is a deeply sensitive yet a crucial issue which affects mothers, parents, families as well as to the health professional. This topic is that transcend religion, people, the beliefs, the personal beliefs, the politics, but I believe it's all about compassion, the dignity and the rights of the women who get affected in this kind of situation. And you would understand in our country almost all the mothers are going through the antenatal care at the institution. Out of all mothers will get a chance to undergo the early scan either in the first trimester or the second trimester, that means before 20 weeks of pregnancy. As you know, all our mothers who gets the hospital care for their pregnancies will have a chance to get a scan done either in the first trimester or in the second trimester. Unfortunately, some of these scans reveal lethal fetal anomalies. In number wise, it's about 2 per 1000. Even though these numbers are small, it carries a lot of the physical, mental and the emotional impact for the mothers who get affected by this situation. And these conditions, as you know, when you see a baby with problems of neural system or the heart system, we obviously know that there's no chance a baby to survive during the pregnancy as well as after birth. Then the question comes, how you convey this message to the mother. It's really heartbreaking and devastating, and it's very difficult, it's extremely difficult for healthcare professionals as well to convey this message to the parents, and the conversation itself is really a nightmare for us. In this situation, now we have to tell them your baby is not viable or not going to survive, and then we have to give the option what to be done next. This is actually a very difficult situation. Mother and the parents and the family already know they have a baby who could not survive. Still, they don't have any other option other than continue pregnancy and wait till baby to deliver by in natural method. As you know, in last few decades, the countries have changed their abortion law in a way that they permitted, and most of the countries they permit abortion to get done in a safer place for the mothers who already been diagnosed to have a lethal fetal anomalies. But in our country, that option is not available for us. And even if the mother asks whether I could get this baby terminated because I don't want to go through this agony, I don't want to continue this pregnancy because it's very difficult for me. During the conversation, from our experience, we know most parents they ask, now of course actually baby is not surviving, if there are any chance that they could get done termination from any safe place. The problem we are having is within our legal frame, because we are not permitted to do termination in a safe environment in our institution. The only answer that we could give was no. So they would ask us, doctor, if the baby is not surviving, why should we continue, and who has laid down these laws? Is it reasonable? Then we become helpless, and we are not the actually we only the health professionals, we were not the people who had laid down these laws and restrictions. Then again we have to explain them in a way that our duty to look after the mother till the term or whatever the pregnancy, they would continue the baby in a live status, otherwise no termination is provided. Then most of mothers and parents and their loved ones, they ask then most of the mothers and couples they are, if there are, if then most of the couples they ask if there's no place in your system, whether they could go for another place to get a termination done. In that case also we don't have any answer, because the termination has been considered as a crime in our legal system. We are not supposed to direct them or to any place where the abortions have been done. And of course, there are places, everybody knows, terminations have been done outside the health system. They are really unsafe, done in a very inhuman way, and without anesthesia, and with no proper instrument, and most of the time these mothers are developing complications due to the improper unhygienic procedures like infections, and that will jeopardize their entire reproductive life thereafter. The other problem they are facing is knowing that they are having abnormal baby, they have to continue and carry out their work. If you are a working woman, you have to go to the working place, and there are a number of questions from your friends. And as you know, if you become pregnant, there are a lot of happiness and the dreamings, and then expectations, and all of a sudden you get to know your baby is not doing well and not going to survive. And these questions are really agonizing, in the sense, if your loved ones or your relatives or your friends asking now what is happening, and I don't think it's a easy situation for mother to answer everybody and carry out their normal day-to-day life. The other situation is, of course, these anomalies have been diagnosed at very early stages in the pregnancy. If the termination option was available, of course they go through a safe termination, and then can get counseling and get treated and finish this scenario, and then get recover, and then can prepare for their day-to-day normal life, or can go back to their normal life soon. But while the pregnancy is being continued, so they have to tell everyone, the family members and to the other people about their situation. By in certain circumstances, in certain societies, the having abnormal baby is considered something not really good for that family, and there's a social stigma which they had to face through, and obviously this is not really a very pleasant condition for family already been affected, as well as to the healthcare professionals who provide the support. As obstetrician clinicians who face this situation, I believe there should be a change in this law, at least to provide safe termination for the couples who already get diagnosed their babies not surviving, having lethal fetal anomalies, because that will actually safeguard their health and also prevent them to go through the mental agony and this devastating situation. And this really should something that we have to think about.